We are dealing with so many obstacles these days for our health, the economy, the never-ending stress that comes with the pandemic.
Life may not be perfect, but you can develop a set of skills to overcome obstacles as they arise, face them, and thrive.
And we have Christy Edwards, Executive Director and Therapist at Centers for Children and Families, live with us to talk about developing resiliency. Good morning, Christy.
Good morning.
Good morning. What is resilience?
So resiliency is the ability to bounce back from stress, adversity, failure, challenges, or even trauma. The good thing is not something that you either have or you don't have. It is a skill that you can develop. What we know is that resilient people take healthy risks because they don't feel falling short of the expectations. They just have that, that feeling that everything is going to turn out okay, whether they meet their expectation or not. They know their strengths. They push themselves out of their comfort zones. And this helps them reach for their long-term goals. And, basically they're able to solve problems independently.
Very important to have that information there. And also, we're looking at more that's going on when it comes to resiliency, and as well as making sure that we're ready to face it. But are you born with resiliency, or is it something that you have to work to develop?
I mean, it's partially inborn, kind of like our personalities are kind of already hardwired for us, but it can be learned, and it should be developed and learned. Wouldn't we all like to be able to handle life's challenges with greater ease and to grow from adversity and to turn negative events into positive ones, right? So these are the steps that we teach, or we, in therapy, encourage. Develop the right attitude. Difficulties are only challenges. Respond with action. We all know people that are, just have a downer attitude or a more negative attitude. So the positive right attitude is important. Develop an internal locus of control, which basically means I take on responsibility for the things that I do and the outcomes that I have. You have to believe that you're in control of your life. And while we can't control all of our circumstances, we can control how we respond to them. So cultivate optimism. View the world while you maximize your strengths and accomplishments. Look on the bright side. Develop a social network. Supportive friend or network of friends can help lighten the load. And maintain your sense of humor. If you're able to laugh at life's frustrations, you will tend to experience life as less stressful.
And how can parents help kids build resiliency?
Earlier I said something about, being able to problem solve independently. Parents sometimes, have the gut reaction to jump in and help the child so that the child doesn't experience any discomfort. That actually weakens the child's ability to be resilient. So what we want the parents to help the children do and to do for themselves and model that is to build a strong emotional connections. Kids develop coping and problem-solving skills within the context of a caring, loving, supportive relationship. Promote healthy risk-taking. Encourage your child to try a new sport, participate in a school play, start a conversation with a shy child on the playground or in class. Help our kids label their emotions. This is a big problem that we're seeing in kids starting as young as 6 or 7. We need to be able to teach our kids that all feelings are important. It's not just sad, mad, glad, right? So tell them it's okay to feel anxious, sad, jealous. Reassure them that bad feelings usually pass. We don't want kids to get caught up in this thought that, whenever I get in a bad place, it's never going to be over. So we want to teach them coping skills. Teach them about deep breathing, about mindfulness, have them take a walk, talk to someone you trust, and let them process their frustrations with you. So embrace their mistakes, yours, and tell them about some mistakes that you've made. So you can say, you will get through this. We all make mistakes. So don't make that the be-all, end-all of anything they might do. And then parents need to model their own resiliency. Use the coping and calming strategies that you know. Label your emotions and use humor.
Very important to develop these skills. And 2 questions on this. How young do you take patients, and also you're offering free sessions to develop these tools for those on the front lines?
Yes, we are. Okay, so centers in the Midland and Odessa offices, we start with children as young as 3. We believe that their social emotional development is not ready before that. And we do, that's one of the first things that we start with. We try to help them develop their emotional vocabulary. We find out where we are. We find out how involved the parent is. and then we can kind of start building that parent-child relationship that hopefully will be end result in a healthier child. And yes, we are currently offering free sessions for first responders. And if you think you're a first responder and it might be outside what we normally think of EMTs, doctors, sheriff's deputies or whatever, give us a call. We're going to talk to you, and we will probably decide that you're a first responder in whatever job you are and offer those free sessions to you as well.
Thanks so much, Christy.
Thank you.